Hello to everyone, my name is Luis Montalvo and I'm a med student at Universidad Católica Santiago de Guayaquil. Here are my Facebook, Twitter, and YouTube accounts, so you can watch the other two videos I uploaded, which are about the effects of leukotrienes in asthma and how to prevent fractures with the use of zoledronate in patients with osteopenia, especially older women. Now, today I'm going to talk about anticoagulation with or without Clopidogrel after transcatheter aortic valve implantation. Definitions: TAVR or TAVI is a transcatheter aortic valve implantation, or TAVR is a transcatheter aortic valve replacement. It is a minimally invasive procedure to replace a narrowed aortic valve that fails to open properly, which means aortic valve stenosis. In this procedure, doctors insert a catheter in your leg or chest and guide to your heart. Coagulation. Coagulation, also known as clotting, is a process by which blood changes from a liquid to a gel, forming a blood clot. It potentially results in hemostasis, the cessation of blood loss from a damaged vessel, followed by repair. Clopidogrel. Clopidogrel, sold under the trade name Plavix among others, is an antiplatelet medication used to reduce the risk of heart disease and stroke in those at high risk. It is also used together with aspirin in heart attacks and following the placement of a coronary artery stent. Now I'm going to play a video for you in which you can watch how coagulation happens.
At the site of vessel injury, the first platelets arrive to start sealing the wound. Simultaneously, the coagulation cascade with its various coagulation factors is activated. This involves two pathways: the extrinsic and the intrinsic pathway. Extrinsic activation begins with now exposed molecules of the vessel wall, such as tissue factor, which forms a complex with factor VII. Finally leading to the activation of factor X. This factor Xa is the point at which the extrinsic and the intrinsic pathways of the coagulation cascade meet. The intrinsic pathway consists of various coagulation factors activating each other in a chain reaction. At its end, a complex with an additional cofactor is formed. This complex now activates factor X. Since the two pathways merge at the level of factor Xa, this factor has a pivotal role in the coagulation cascade. Further down the cascade, factor Xa in combination with 5A activates thrombin and induces the so-called thrombin burst. One molecule of factor Xa can catalyze the formation of 1,000 molecules of thrombin. These large amounts of thrombin cause the further activation of platelets and the enhanced formation of fibrin. Fibrin then forms strands, making up the mesh that stabilizes the platelet plug in an arterial clot and holds together the red blood cells in a venous clot. It can be concluded that the central role of factor Xa in the coagulation cascade makes it a viable target for therapeutic intervention in pathologically altered blood coagulation.
Applications in medicine. The procedure is complicated by major and life-threatening bleeding in 3 to 13% of patients, and strokes occur in 1 to 12% at 1 year after TAVI. Atrial fibrillation is common in patients undergoing TAVI and constitutes an indication for long-term oral anticoagulation therapy. The rationale for additional antiplatelet therapy after TAVI is to reduce the risk of thromboembolic complications, but the trade-off of the risk of bleeding has not been well studied. But first, this video is about TAVI, so you can know what this procedure, how this procedure is done.
TAVI stands for transcatheter aortic valve implantation. This is a new procedure for replacing a faulty aortic valve in the heart. The aortic valve opens to permit blood to flow from the left ventricle into the aorta, which carries blood to the rest of the body. The valve closes between heartbeats to prevent blood from flowing back into the ventricle. If the aortic valve does not open or close properly, the heart has to work harder to pump blood into the aorta. This can cause symptoms such as chest pain and shortness of breath, and may ultimately lead to heart failure. Treatment of a faulty aortic valve generally requires open heart surgery. The surgeon cuts through the chest bone, stops the heart, removes the faulty valve, and replaces it with a mechanical or biological valve. With TAVI, an artificial valve is implanted via a catheter, which is navigated to the heart through an artery via an incision in the skin. The femoral artery in the leg is most often used, but others, such as the subclavian artery beneath the collarbone, may also be used. The replacement valve is placed inside the existing valve. The procedure is performed on the beating heart, without the need for a heart-lung machine. Both procedure and recovery time are significantly reduced.
Treatment. Current practice guidelines on antithrombotic treatment in patients who have an indication for anticoagulation after TAVI are based on expert opinion and suggest a vitamin K antagonist either alone or in combination with aspirin or Clopidogrel. This paper, which is a paper I read in order to make this presentation, this paper showed the incidence of bleeding in both forms of treatment to decide which one is better.
The ARTE trial, the objective was to evaluate, to compare dual versus single antiplatelet therapy as antithrombotic treatment following TAVR. As you may know, dual antiplatelet therapy is the recommendation in all guidelines, but this is an empirical recommendation. There are no studies as yet showing superiority of dual versus single antiplatelet therapy in these patients. Then when we designed the trial, which was a pilot study, we tried to get objective data on what were the outcomes in these two groups of patients, looking particularly at ischemic events, myocardial infarction and stroke, death, and then bleeding events. In the design of the trial, the primary endpoint was a combined endpoint, including death, MI, stroke or TIA, or major or life-threatening bleeding events. The design was this was a prospective, randomized, multi-center, open-level design study, a pilot study. And we used TAVR technology, but only balloon expandable valves, SAPIEN XT or SAPIEN 3. And the patients included, well, all comers. The main exclusion criteria were patients under chronic anticoagulation, patients that were requiring dual antiplatelet therapy because of recent coronary stents, drug-eluting stents, or patients with a major prior bleeding. Otherwise, the patient could be randomized, and the patients were randomized to aspirin alone, low dose of aspirin alone, or aspirin plus clopidogrel. And they were randomized the day prior to the TAVI procedure. Aspirin was continued for at least six months, and clopidogrel for 3 months. The primary endpoint was at 3-month follow-up. The main findings were that when we look at the primary endpoint, the combined endpoint, in the dual antiplatelet group tended to have more adverse events than the aspirin alone group, and this was mainly driven by a much higher rate of major or life-threatening bleeding events in this group. There were no differences, the numbers were small, but there were no differences between groups in the rates of myocardial infarction, stroke, or death.
Pros and cons of oral anticoagulation plus clopidogrel therapy. The pros are that first, this therapy reduces clot formation. Second, reduces thromboembolic complications such as stroke or myocardial infarction. And the cons are that patients that were treated with dual therapy, in contrast to the ones treated with only anticoagulation therapy, were more likely to suffer from this. First, bleeding. Group 1 is a group of people treated with anticoagulation, it's treated with EA, with anticoagulation plus antiplatelet therapy, and the group 2 is a people treated with only anticoagulation therapy. So there was a higher percent of people that suffer from bleeding in group 1, people treated with anticoagulation plus antiplatelet therapy. Major life-threatening or disabling bleeding, group 1 was also higher. Minor bleeding, group 1 is also higher with 17.9 compared to 12.7. And finally, there were more people that died from cardiovascular diseases in group 1 than in group 2. Issue in Ecuador. The global prevalence of aortic stenosis in people over 65 is around 25%, and in people over 75 goes up to 48%. There is no data of aortic stenosis prevalence in Ecuador, but according to articles from El Comercio and La Hora, TAVI is done in several Ecuadorian hospitals, most of them located in Guayaquil. Now, for the people that speak Spanish and haven't understand yet how TAVI works, how TAVI is done, here is a video in Spanish.
Tradicionalmente, las pacientes cuando tenían problemas de válvulas se operaban a corazón abierto. Ahora mismo se puede hacer a través de la pierna con anestesia local, y esto se debe a que las válvulas son como puertas que tienen que abrir y cerrar, y en concreto la válvula aórtica, en el caso de las estenosis, es que abre mal. Entonces lo que hacemos es, metiendo un catéter, un tubo de plástico a través de la pierna, llegamos hasta la válvula aórtica y procuramos desobstruirla, abriéndola y poniendo una válvula nueva que asienta sobre la válvula que ya tiene el paciente.
Las principales ventajas de esta técnica frente a una cirugía convencional son principalmente una reducción de la estancia hospitalaria, principalmente sobre todo en pacientes muy mayores, que en muchos casos han sido desestimados para cirugías aórticas convencionales, o sea, con esternotomía, y de esta forma lo que conseguimos es reducir también el riesgo de complicaciones de estos pacientes.
Aglutinamos a anestesistas, intensivistas, cirujanos vasculares, nefrólogo, neurólogo y nosotros mismos. Todo este equipo evalúa al paciente antes de venir hoy a la sala para realizarse el procedimiento.
In conclusion, in patients undergoing TAVI who were receiving oral anticoagulation, the incidence of serious bleeding over a period of 1 month or 1 year was lower with oral anticoagulation alone than with oral anticoagulation plus clopidogrel.